One of the biggest things I realized after graduating was that there's a real difference between knowing a condition and understanding it well enough to explain it simply and confidently to a patient. University teaches us the science. Your supervisors want technical explanations when you present your patient. But clinical practice teaches us how to translate that science into a language that patients understand, while also developing the clinical reasoning behind every assessment and treatment decision. I'd like to help you bridge that gap. The idea is pretty simple. Every couple of weeks we jump on to Zoom for around 45 minutes in a relaxed, informal setting. These sessions will be interactive and discussion based, and we'll work through real clinical cases together and explore questions like, what's actually going on here? What assessments should you perform and why? What do those assessment findings tell us? How do they direct us? How do they influence our treatment plan? And probably the most important question of all, how would you explain this to your patient? We'll take turns practicing how to explain common conditions in everyday language, discuss our clinical reasoning, and build confidence together. I'll bring interesting cases to each session, and if you've seen something on placement that you'd like to discuss, bring that along too. The concept has been really well received, and I'd love to make this a regular mentoring group if there is enough interest. So, at this stage, I'm simply looking for expressions of interest. So, if you're a podiatry student and this sounds like something you'd enjoy, please let me know and send me an email. The details are below. If enough people are interested, I'll organize a time that works for everyone and we'll get started. I'd love to help you become not just someone who knows podiatry, but someone who can think like a podiatrist and communicate with confidence. Hopefully, I'll see you there.